Valacyclovir is an antiviral medication that is used to treat herpes infections. It is a prodrug of acyclovir. It is going to be extensively metabolized in the body to produce acyclovir. It is the L-valyl ester of this medication. On administration into the body, it undergoes first-pass metabolism, where it releases acyclovir. Valaciclovir has several advantages over acyclovir. It has higher bioavailability. That means it is more absorbed into your body. It releases more amounts of acyclovir into your bloodstream. So compared with acyclovir, it has more bioavailability. Therefore, it requires less dosing frequency. It can be given twice a day. However, in the case of acyclovir, you might need to take it up to 5 times a day. It is available as oral tablets, and it has similar rates of healing and pain reduction in people with herpes infections. Valaciclovir is safe and well tolerated. The most common side effects are the headache and rhinitis. It is also less expensive. It is around 20 times less expensive than intravenous acyclovir. Acyclovir released from this medication is widely distributed throughout the body, including the brain, kidneys, and muscles. It better penetrates into the cerebrospinal fluid. In this video, let's discuss the important information about Valaciclovir. How does it work? What are the important precautions that should be considered? What are the common side effects? How to take this medication? All such things we will discuss in this video. First, let's see the uses of Valaciclovir. This medication can be used for the treatment of herpes infections. Herpes labialis, also known as cold sores or fever blisters. It produces small, painful blisters on the lips and around the mouth. This is caused by herpes simplex virus 1 infection. Genital herpes is a sexually transmitted infection caused by the herpes simplex virus. It causes painful blisters and sores around the genitalia. It is most likely caused by herpes simplex virus 2 infection. Valaciclovir is effective against both herpes simplex type 1 and 2. Therefore, it can be used in the treatment of cold sores and herpes genitalia infections. Varicella-zoster virus causes chickenpox in the children and shingles in the adults. In chickenpox, children may have a rash with small and itchy blisters. Valaciclovir can be used in children over the age of 2 years to treat chickenpox infection. This medication can be given to reduce the duration and severity of the illness. In adults, herpes zoster can produce shingles, which produce severe itching, painful rashes, and burning. Valaciclovir will reduce the pain and severity of the rash. It also reduces duration in people with shingles, caused by varicella-zoster virus infection. However, in this infection, it should be started within 72 hours of the onset of symptoms. For Epstein-Barr virus, again, this medication can be used off-label. This virus can induce sore throat, fever, and swollen lymph nodes. Extreme fatigue and enlarged liver may also be possible. Valaciclovir prevents these viral cell replication and improves outcomes in people with COPD. How does it work? Valaciclovir inhibits viral DNA replication. It competitively inhibits the viral DNA polymerase, and it also causes chain termination. This results in the stopping of the growth of the herpes virus. After administration, Valaciclovir is going to be converted into acyclovir in the liver and intestines. Therefore, acyclovir is the active form of this medication. Acyclovir acts as a nucleoside analog that mainly targets the herpes virus. It can affect both herpes simplex virus types 1 and 2. It is also effective against varicella-zoster virus infections. Interestingly, acyclovir is activated initially by the herpes virus. It is phosphorylated by the viral enzyme thymidine kinase. This results in the formation of acyclovir monophosphate. Then it can be further phosphorylated by host cellular enzymes into the acyclovir triphosphate. This acyclovir triphosphate can competitively inhibit the DNA polymerase in the viral cell. DNA polymerase is required for the addition of nucleotides to the growing chain of DNA. By blocking this enzyme, acyclovir prevents DNA replication. Acyclovir triphosphate can be incorporated into the viral DNA. However, it is non-functional. It cannot produce chain elongation, and it can act as a chain terminator. How is it given? Valaciclovir is available as a tablet at 2 strengths, 500 milligrams and 1,000 milligrams. In other words, it is 1 gram. The dose of Valacyclovir depends on many conditions. It also depends on how your immunity is working. In people with HIV infection, the dose may be modified. For treatment of cold sores, it can be started at 2 grams orally every 12 hours. For treating herpes zoster infections, it can be used at a dose of 1 gram every 8 hours up to 7 days. The treatment may not be effective if you're going to start after 72 hours of rash observed. For treating genital herpes infections on the initial episode, it can be started at 1 gram every 12 hours up to 10 days. In case of recurrent episodes, it can be started at a low dose of 500 milligrams, given twice daily for 3 days. However, you have to start within 24 hours after the onset of the lesion. Precautions. It is better to start the treatment with Valaciclovir when you find the earliest symptoms. If you observe tingling, burning, and itching with cold sores immediately, you have to start with Valaciclovir. For genital herpes, it should be started within 72 hours of the onset of the first diagnosis or 24 hours of the onset of recurrent episodes. For herpes zoster, it should begin within 72 hours of the onset of the rash. Valaciclovir can affect your CNS. It may produce a few of the central side effects, like agitation and hallucinations. You may have confusion. It may also produce encephalopathy. The risk of the central side effects is more pronounced in the older people. If you have any renal dysfunction, you should use this medication carefully. Valaciclovir can produce acute renal failure. Again, this effect can be more pronounced in the elders. If you're taking any nephrotoxic drugs, the effect on kidneys may be increased. Therefore, you should not use higher doses than recommended in case of any renal dysfunction. While using acyclovir, you should maintain adequate hydration. Poor hydration may result in the precipitation of acyclovir in renal tubules. This is due to the decreased solubility of this medication in intratubular fluids. This may produce renal tubular damage if it is not cleared from the renal tubules. Therefore, adequate hydration should be maintained in order to prevent damage to the renal tubules. Even though rare, Valacyclovir can cause a condition called thrombotic thrombocytopenic purpura. This is one of a serious blood disorder that can be observed particularly in people with reduced immune activity. TTP results in the formation of small blood clots, particularly in the small blood vessels. This reduces the blood flow to the organs, leading to their damage. This condition can be observed in people with advanced HIV disease and renal or bone marrow transplantation. It may result in fatigue, abdominal pain, fever, and shortness of breath. Blood and urine and even jaundice-like symptoms can also be observed. Therefore, in people with low immunity, these symptoms should be closely monitored while using Valacyclovir. What are the side effects of this medication? One of the common side effects of Valacyclovir is the headache. It can also produce neutropenia, a decreased neutrophil count. This medication can also increase your liver enzymes, like aspartate transaminase and alanine transaminase. You may also have abdominal pain, nausea, and nasopharyngitis. Other side effects, like agitation, joint pains, and dizziness, can also be observed. That's all about this medication, Valacyclovir. Thanks for watching this video. Share your experience and how it works for you in the comment section below. Have a great day.